just freaking did my first. I just freaking did my first chest thoracostomy. Damn. My God. Damn. I'm sorry. I'll just see you guys later. Obviously, you need to know about it. Yeah. So I knew about it. You have to know what is required for the procedure and all of that. But it's nothing compared to doing it by yourself.
That's what I'm asking you about it. So I want to hear about the steps.
No.
You have to stay with the steps again. After the procedure, so you see what you get. Assignments, once I'm that's some stuff and do something.
See, oh God. Exactly.
You will.
I'm shaking. I can't say like I wasn't scared. Okay, what if? But I feel like the drive to do it or to get it right was more than the fear. Oh, I'm shaking.
Okay, now the drive to get the pistol.
Please.
Right?
Please wait before you escape.
No, it's exactly something we did.
No.
Find it. Before that procedure, when you do the procedure, just have to drive find it. Sign not what's 1,300 so
that's where.
Just press that right find it. Then come down with another procedure.
So hi guys, I'm Njoku Martin's Dr. NGM for short here, and you're very much welcome to my channel. For those of you that are new to my channel, you're very much welcome. I'm a medical doctor living in Nigeria, and I'm currently doing my housemanship. This is my week 8 of 52 weeks of housemanship. Yay! So yes, I am in Cardio-Thoracic surgery unit. Yeah, maybe one or two persons hinted at it here. And yes, Cardio-Thoracic surgery unit. So I'm with the finest, should I say finest? Weirdest man in Umaya. I look tired, near asleep. This is my second day in CTU, and today is supposed to be our clinic here, and this is literally around 12 noon and we are done. I can't be even more excited. Like, I don't know, we are done with clinic, we're done seeing patients, and I'm just imagining to myself, so there are units that can be as chill like this, literally. So yeah, it's time to go home. I'm not wearing my glasses. I hope you can still recognize me. So I'm in CTU unit now. This is like my third day in the unit, and we're having ward rounds today. Hopefully it's not going to be stressful because we have only 2 patients. That is my joy. That is the joy of every doctor, not to have as much patients. But yeah, that is that. I'll catch you guys later. yes, we are progressing. I am currently doing my cardiothoracic surgery rotation. So I'm currently in cardiothoracic surgery unit, that's CTU. Congratulations for those of you that got the hint. Yes. I know it's somehow the hint I gave about it being about us in Nigeria not having a lot of the surgeons here kind of made you guys think it might be neurosurgery, but I think we have a lot of neurosurgeons in Nigeria, trust me. But yeah, it's cardiothoracic surgery unit here, and I've had a blast. Literally, I don't know, I feel like my surgery rotations just keep getting better, not stress wise, but like I mean skill wise and knowledge wise. Do you get what I mean? Yeah, it's just beautiful, trust me. And I passed my first chest tube. I did my first closed tube thoracostomy drainage. I inserted my first chest tube, like every freaking thing from the beginning, like to make the incision, to pass the tube, to make the sutures and all of that. Oh god, I don't know, I was over the moon, completely over the moon about it. I'm still over the moon about this. I just wish I can be able to do it again and again and again. Yeah, we've been craving or praying for another opportunity. I don't know if it's a good thing to be saying this, that you've been praying for another opportunity to pass chest tube, but well, yeah, I've been praying for another opportunity to pass another chest tube. Yeah, so just to solidify my skills or to solidify my hands in this skill, yeah, that kind of thing. So yes, and the experience was just surreal. The day was actually going really bad. Like I was waiting for the patients to get their materials, and then I had to wait a little while for everything to be set and everything. And then finally when we came in the evening, yeah, God, I thank God for this rage that actually gave me the opportunity to do that. Do you get? I don't know if a lot of regs would be willing to give their house officers the opportunity, but I'm very grateful. It wasn't even my suggestion. It was just like we had two persons. We had two closed tube thoracostomy to do that day. Yeah, and after he did the first one, he just told me, you are doing the second one, and I froze initially. Do you get? But then when everything was set, I feel like the urge to do it was far more than the fear I had. Do you get? This patient had bilateral breast CA, and it was really bad, and she was in severe respiratory distress. So I don't know, I just had this inclination that, see, you have to get better somehow, and the only way for me to alleviate her suffering was to be able to pass the chest tube. Do you get? So I don't know, I feel like the urge to want my patient to get better was more than the fear I had. Or no, I don't know if that makes sense, but yeah, that was how I was able to overcome the fear. Do you get? After I cleaned, I draped and gowned, and he just gave me the knife and was like, Gloria, you got this. I was with the knife and I was like, a lot of thoughts came through my mind at that moment. Do you get? And I was like, what if you get it wrong? What if something goes wrong and all of that? But I just did it. Yeah. And then he kept telling me I was doing very well. Do you get? I don't know. I'm so blessed to have had the amount of support. Do you get? It's one thing to be doing these things, and then it's another thing to be doing it in a very toxic environment where they are literally shouting at you and all of those. Well, I feel like I was literally just blessed. Do you get? And yeah, to pass my chest, to do my first closed tube thoracostomy in my first week of cardiothoracic surgery unit rotation, it is mind-blowing. Do you get? It is mind-blowing for me. Do you get what I mean? I actually thought, okay, naturally people say cardiothoracic unit is a very chill unit, we don't get to do a lot and blah blah blah. But then I am in this unit, and the cases I've seen alone, I feel like I've been the most shocked in this unit in my entire rotation. Orthopedics I've always been attending my orthopedics rotation. I've done 2 rotations. I did 2 rotations in the university, yeah, And then coming here to do orthopedics was like, okay, one of the things I was very conversant with and all of that. Then we went to urology. I kind of liked urology before coming here, yeah. But then we went to on pediatric surgery. Pediatric is another favorite you get. But then, yeah, after that, Cardio-Thoracic unit. And I've just been my mind has just been completely blown away from every single rotation. Surgeons are a miracle. Surgeons are a blessing, rather, you get to the society generally. The things they do. I don't know. It's safe to say I'm in love with medicine, yeah, but then surgery, it's a whole different level. You get to a whole different level. Maybe when we get to internal medicine, we'll talk about how internal medicine is beautiful and all of that. But allow me to give credit to surgery people. Like, thank you so much for all you do. Literally, the experience of getting to do a closed tube thoracostomy drainage was just so surreal. Or it's still so surreal. You get. So after that day, my reg kept telling me, well, you're going to have to pass another chest tube. Like, to him, it's like something house officers are actually supposed to do. Now, I've had plenty interviews with a lot of house officers while I was still in school, yeah. And a lot of them one of the questions I asked is, what skill do you as a house officer need to gather, like, during the course of your housemanship here? And most of what I got to find out from them was cannulation, cannulation, what again, catheterization, what again, what else, suturing. That's like for people that are really very enthusiastic about learning though. But then majority of them said cannulation and catheterization. Do you get? Well, that's beautiful. You have to know how to cannulate, do you get? And you have to know how to pass a urethral catheter, do you get? Obviously. But I'm not trying to say that these are the only two skills that you are supposed to know. I feel like there should be more. Do you get? That was another reason why I kept asking that question. What skills do house officers need to know, like, within the course of their housemanship? And ever since I have started my housemanship, I've realized that there are so much more skills that you need to gather as a house officer. Now, if you can't be able to gather these skills here, when would you possibly want to gather these skills? Is it when you become a medical officer, when you're not in training? Is it when maybe you become a resident? When exactly? Is it when you become a registrar, senior registrar? When exactly? I feel like a lot of people out there, a lot of quacks, have the confidence that a doctor requires, but they lack the skills. But then a doctor, an average Nigerian medical doctor, have the knowledge, but then lack the skills. I feel like they should go hand in hand. So aside cannulation and catheterization, urethral catheterization, I also feel like we should add more to this list. Now, I made a list, I made a list for myself that I need, list of things I need to be able to know. Do you understand? Like, list of skills I need to be able to gather while I'm doing this housemanship, yes. Do you get? But then it was so limited. Do you get? It was super limited. But then in the course of my housemanship, the list just kept growing. Do you get what I mean? The list just kept growing because these are things you need to know. Thoracostomy, obviously, you need to know that. Do you get? You don't need to learn it by chance. Do you understand? And I know that what most of us do is that, I'm still very early in this housemanship thing, and maybe towards the end I'll get to be gathering all the skills, all the errands we are running, all the drugs we are giving to the patient, and all of that is taking our time. But then that should not be your focus. You should be willing and you should strive to do even more. Do you get what I mean? Yes, you should strive to do even more. For instance, catheterization. Now, for those of us that are in surgery, catheterization is one thing I think I enjoyed in my urology posting. I was not just watching surgeries being done. he was telling me how it's being done, why you need to do it this way and not the other way. Do you understand? So sometimes when this patient comes and okay, like you're able to anticipate the next step of management. Do you get? You're able to tell what this patient needs at every single time. I don't know if you get. Yes. So let's not just limit ourselves to these things. Do you get? You should be able to know how to, even if you don't get the opportunity of doing them, you should know how these things are done. Do you get? Maybe when I get into pediatrics, but for surgery, definitely you need to know how to pass a chest tube, thoracostomy, yeah, cannulation, obviously, urethral catheterization, yeah, you do it literally every day. You need to know appropriate size catheter for each patient and then what to use. You need to know how to do what again? Bladder washouts, yeah, bladder irrigation. These are things that we did very commonly in urology, and I feel like a lot of patients need to know how. A lot of doctors, need to know how to do these things. Yeah, which other things? If I remember them, I'll write a list while I'm editing this video. Yeah, but then these are things I feel in my heart of hearts that house officers need to learn how to do. Do you get? Because people are, or we are. Let me not say you people are. We are. According to what they keep telling us, we are the closest doctors to the patients. We are the closest doctors to the patients. And sometimes these things come as, imagine a patient now in the ward having acute urine retention. Do you get? And you want to wait for your seniors to come and your patient is in severe pain. You have to know appropriate size catheter and know how to do urethral catheterization. Apparently, do you get? For patients too that need bladder irrigation, bladder washout, you should be able to do that. Do you get? So if I come across more things I feel like a house officer should know, I would update this list. But for now, let's leave it at that. But so far, in my first week of cardiothoracic surgery, it's been beautiful. Do you get? And I want to advise for. Generally, there's work everywhere. Now, some people want to go to areas to do their house job where there is less work and all of that. And some other people want to go to where there is plenty work so that they are going to learn. Now, the truth about this thing is that where there is less work, yeah, might be where you might learn more. It's just about how you apply yourself. Where there is more work, you might not even have the opportunity of learning. You might just be going for errands, giving patients IV medication, monitoring patients and all of that, and you will not have the opportunity of gathering the skills. So when you go to where there is less work, apply yourself. Do you get? Apparently in cardiothoracic units, the rumor was that they don't usually have a lot of patients, they don't usually have a lot of things. Do you get? And then there is me having 2 patients every single day. And in cardiothoracic unit here, yeah, we don't have unit A, unit B. We just have cardiothoracic units. And you know that you're on call every single day. As I'm making this video now, I know I'm on call. Do you get? So you're on call every single day, yeah. But then, yeah, we had patients back to back. In some other persons, it wasn't as busy as this. So I don't know. My reg keeps saying that it's because of me that patients are coming. But well, there's a thing called patient magnet. I don't know. I just happened to be here and we're having a lot of patients. And that was an opportunity for me to learn. So imagine in my first week now, we didn't have any patients. How was I going to know how a chest tube should be passed? And how am I going to know how to remove a chest tube? Do you get? Purse strings and all of that. How am I going to know how to remove a chest tube? So these are things that, I don't know, just apply yourself. There would have also been an opportunity, a possibility where, okay, it's just my reg that is doing those things and I'm not as much interested in them. Do you get? Like they say, no knowledge is a waste. And I feel like, well, the way I'm saying this, there are some people too that hate surgery with passion, but then no knowledge is a waste. So far as you're going to do the rotation, why not get the skill? Why not get the knowledge? Do you understand? You might end up doing your NYSC posting or become a medical officer and be required to do these things for your patients. Do you get? So why not just gather the skill? Do you get me? I I feel like I've been blabbing too much, but yes, what I'm trying to say is that surgery so far has been very interesting. Do you get? And I know that my last posting, well, my last posting is still a bit far, but yeah, I know that my last posting here might be one of the toughest so far. Do you get? But then I'm just very grateful. So far, surgery has been really beautiful, and every single patient I've come across. I was on the road coming back from somewhere today, and my patient was in a keke, and he was like, "Hey, doctor." And it's the patient with discharge, and just the joy of it alone is just beautiful. Do you get? And well, those are the things that part of the things that make the rotation beautiful, seeing your patients get well and are discharged home. So generally, surgery has been beautiful. Do you get? Surgery has been so beautiful to me. Do you get? So my advice to people that are maybe scared of surgery, don't like surgery, maybe just want to do surgery. There are people like that, you'll be shocked. Just want to do surgery as quickly as possible and get out of there. You get? You're going to be there for 3 months based on how your schedule works in your hospital. Yeah, you're going to be there for legit 3 months, 3 freaking months. Do you get? Maybe not in a particular unit, maybe not in a particular rotation, maybe in different units. So why not just keep an open mind? Just keep an open mind. There are a lot of people, and well, let me not start debunking everything, but here there are a lot of people that have made up their mind where they want to get into. Do you get? Which specialty they want to, which area they want to specialize in. So when they come into housemanship, I just want to be serious with one particular rotation, and then every other one I can trash it. If it works for you, fine. Do you get? But then why not just gather the skill? For the most part of your stay in Nigeria, do you get? These skills are going to be necessary and needed and in high demand. So why not just gather the skill as much as possible? Do you get? And to those chiefs, to those regis, to those senior regis here that give opportunity for their house officers to learn, that give opportunity for their younger ones to learn, that encourage them, that are not toxic, that don't shout and beat and slap their juniors. Thank you so much. Do you get? Because I don't know, I feel like it's the bad ones that we're always talking about, so let's give the good ones some accolades. Do you get? Naturally, these things are not supposed to be like this. Is not supposed to be the status quo where we come and we say, my chief is very toxic. It's not supposed to be heard of, because I don't know if there were people like that were teaching you. I don't think you liked it, so why should you inflict such pain on your younger ones? To all of you that are not toxic, that give opportunity for your younger ones to learn, this doctor in particular, should I call his name out? Well, yes, Dr. Uchechi. Funny enough, he has a weird female name, and my reg, Dr. Ainaya. Thank you so much. Thank you so much for giving me the opportunity to practice properly, for giving me the opportunity to be involved in my patient's care. Thank you very much. And if you have questions, if you have complaints, if you have questions whatsoever, feel free to leave it in the comment section. I may not be able to provide you with tested and proven answers and all of that, but from my experience and from the experiences of other doctors that are on this platform, I'm sure they can be able to be of help to you. So yes, that's all for today. Thank you very much. I remain Njoku Glera Martins. I'll catch you guys in the next one. Peace.